Hi, my name's Byron Evans. I'm a physician assistant working at a community health center of the North Country right here in Gouverneur. I am originally from the area. I grew up in Harrisville, did all my schooling down in Syracuse at Lemoyne, and then I ended up coming back up towards this area to work to help give back to the communities that helped raise me and develop me as a person. So that's why I'm here. So something that made me want to practice more of in a rural setting versus like a suburban or even a city area is mainly because growing up I have a lot of family members, close-knit family, and wide variety of age ranges, and lots of them have potential health concerns or even just regular doctor's appointments. And having to see them, drive an hour away plus to get to these appointments is a burden on not just them, but, loved ones waiting for results and stuff like that, or even just to get refills on prescriptions if it's been a while since they've been seen. So seeing that kind of hardship and difficulty made me want to come back up here and also maybe take a little bit of the pressure off of those specialists or those providers that are way down and give the community more of a resource. That way we can at least do the initial legwork before referring out. In terms of the way I practice, I usually try to obviously keep an open mind because everyone's perspectives on things are different, or their backgrounds, whether it be culturally, ethnically, or what have you. So I try to incorporate that as much as I can into what we do. But I usually try to address as many concerns as I can and do, like I said, the initial workups. And if something, is wonky or there's something that stands out, refer as appropriately to the specialist so that they can kind of handle it and take it from there. So that's kind of the overall practice of what I do. And, that involves regular labs, imaging, diagnostics, all that sorts of stuff. So I'm seeing a full range of all ages from birth until the ends of life. So outside the clinical setting, as I mentioned, I come from a pretty large family. I do like to spend a lot of time with them. Usually we play like board games, card games, all sorts of things to keep us occupied, go camping or whatnot, family vacations. But for me personally, things that I enjoy doing, I'm pretty big into comics, video games. I like to play my guitar, sing. Like doing a lot of outdoor activities as well, hunting, fishing, hiking, camping, as I mentioned. And I also enjoy cooking quite a bit. Not much of a baker, but I do enjoy trying different foods and trying different recipes and stuff like that. So if you ever have any good foods, bring them to me during the appointment and I'll try them out. I want to say there's an overall passion for, let's say, a specialty. I kind of enjoy all aspects of medicine. I've always been very intrigued in a scientific mind, wanting to learn as much as possible. But I'd have to say probably one of my favorite rotations that I did while in school was I did a endocrinology rotation, so like working with hormones and like diabetes, thyroid issues and stuff like that. So those things are kind of more fun to me because they're a lot of times like a puzzle and you get to kind of rework where the pieces go. So for any of you that are interested in seeking medical care, whether it be for something big or small, or even if you think it might be insignificant, but someone's mentioned it, maybe getting it looked out, I'm more than happy to always see anyone. Whether they're big, small, doesn't matter, old, young, like I said, doesn't matter. Feel free to come on in and we'll see what's really going on.